Equity and equality are different. Equality means everyone is treated the same exact way, regardless of differences. Equity means everyone is provided with what they need to succeed. When it comes to healthcare, we want there to be equity for all.
Everyone should have access to good health care. If you don't have technology, that does not mean you should lose your health care benefits. If you are unable to complete the form for whatever reason, you should not lose your health care benefits. There are resources out there that should be able to, and do help you with this.
That's President of Medicaid for Blue Cross Blue Shield of Illinois, Nancy Walhart. I'm Monica Fox, Senior Director of Outreach and Government Relations for the National Kidney Foundation of Illinois, and your host for this edition of The Journey Continues. This episode, where Nancy and I discuss the basics of Medicaid redetermination and health equity for all, was recorded live at the American Diabetes Association 2023 Illinois State of Diabetes Community Day of Access and Education at Malcolm X College. Welcome, Nancy.
Good morning, everyone. Thank you for having me here today. I'm so excited to be able to talk about Illinois Medicaid and the importance that Blue Cross and our members have in the communities.
Let's level set a bit. What's Medicaid redetermination?
Every year, Medicaid members need to redetermine their eligibility. So they have to complete paperwork that with the state of Illinois that allows them to continue in the Medicaid program. During COVID, however, they halted all redetermination. So for 3 years, members did not have to reapply for their Medicaid benefits every year. Then in April of this year, members started receiving notifications that they are now required to complete paperwork and go through the redetermination process. It is so important that members look for this information. It's coming to them in the mail. So they'll receive a letter from the state of Illinois that will ask them to complete paperwork. They have to submit certain documentation along with that paperwork. And there's multiple ways they can do that. They can either return the form. They'll be getting a form along with the documentation that is required. They can send that back to the state. They can go online through the state of Illinois' portal. It's called ABE, and they can actually do it online. The third way they could do it is they can call a 1-800 number and actually speak live to a representative who will take all the information and lead them through the redetermination process. Or they can fax their information in. So many, many ways for members to be able to do this. They can also work with their healthcare providers. They can work with community agencies, and they can also work with their managed care plan. So if they're Blue Cross members, they can contact us. We will put them in touch with the right folks at the state to be able to complete this paperwork. They have 30 days from the date they receive the paperwork in order to complete it. If they don't, what is very important for them to know is that they will lose their coverage. So we are encouraging everyone to make sure they're on the lookout for this information and to make sure they complete it. If they have any questions, please reach out to the state. You can reach out, like I said, to your managed care plan, your provider. So if your primary care physician, specialist, all providers know about the redetermination and how to help members do that as well. We do not want anyone to lose coverage.
30 days is not a long time for someone to receive correspondence and act upon it.
It is not. And so there are not only the Blue Cross, but the state, they've been actively letting people know that this is coming, right? And they need to be on the lookout for it. There are various ways, too, they can check when their eligibility is up. So not everybody's eligibility is up at the same time. It's over a course of 12 months. So if a member wants to know when their eligibility is up, they can also go online and check that. They can ask a provider who can look it up for them as well. They can call their managed care company. Blue Cross can look that information up for them if they're a Blue Cross member. They could call Meridian. They can call Centene. They can call Molina. There's various managed care plans out there that a member can choose from. So whichever plan they're on, they should call that plan, and we can tell them what date so that they're on the lookout for that paperwork, because it is a very quick turnaround time. Now, if a member by chance missed that paperwork and they miss the deadline, they still have a 90-day grace period after the date their benefits stop to submit the paperwork. But members need to know that if they miss that deadline, benefits do stop on that date, right? They do have 90 days to submit the paperwork, but they're without insurance.
That brings me to my next question about health equity. You know, it's really startling to hear that people can lose their medical coverage. And these really are the most vulnerable people in the population that we're talking about. And when you talk about going online and those kind of things, those are resources that many people may not even have available to them to go online, although there are other options about calling and things like that. But frankly, when you call, sometimes there's a long, long wait on the call lines because many, many people need to call. So let's talk about, again, in level setting, what's health equity, and especially when it's pertaining to a situation like this.
So health equity basically is ensuring that everyone has access to quality health care, no matter what their zip code is, no matter what their demographic is. Everyone should have access to good health care. And if you don't have technology, that does not mean you should not lose your health care benefits. If you are unable to complete the form for whatever reason, it means you should not lose your health care benefits. That there are resources out there that should be able to, and do help you with this. Blue Cross Blue Shield has employed numerous ways for us to be able to help our members, from actually contacting them if they have phone numbers, cell phone numbers, or regular landline numbers with us. We call them to make sure that they know the redetermination is coming up. Can we help you in any way? You can go into one of our Blue Door centers. Blue Door centers are neighborhood centers that we have in various areas throughout the city, in Lawndale, in Morgan Park, in Pullman. We have centers that anyone can walk into and ask for help. There are folks there that are able to help them complete the information, get it mailed into the state, because we know some folks might not have access to a scanner so that they can upload their documentation that is necessary. So we have centers available for that. We've also worked with various community agencies as well that can actually help members complete this, because we do know that sometimes it's a struggle. You don't always have access, or quite possibly you've moved, right? And you're no longer at the address you were when you originally signed up for Medicaid. And if we don't have updated contact information for you, that's why we're making phone calls. For those members who said, we'd rather have you text us, we will text members as well and remind them, don't forget, your redetermination date's coming up. We don't want anyone to lose coverage. I do have to say, though, that the state of Illinois has been extremely good about not just terminating members because they haven't completed their redetermination. They've allowed grace periods, which is awesome. They've also been very concerned about members and making sure that they are completing the paperwork. It is a lot to ask somebody to ensure that you get that turned around so quickly, right? So they've allowed grace periods. They've been very supportive, ensuring that members don't lose coverage. I mean, I think that's everyone's, from providers to the managed care companies, to the state, to the community agencies. Everyone is stepping up and stepping in to help members not lose the coverage. It's very, very important that members continue to have access to good quality health care.
And you're so knowledgeable. Let's get to know you a little bit better. What are some of the main responsibilities in your role at Blue Cross Blue Shield?
I feel very, very fortunate to have the role that I have at Blue Cross Blue Shield. I actually lead all of our Medicaid activities for the state of Illinois. I am passionate about ensuring that everyone has access to good health care, no matter what your age, your demographics, your zip codes. Everyone should have good quality health care. And so that is a mission that Blue Cross is very passionate about. We are very much in the communities that we serve. We are committed to ensuring that people have good quality access, and that is what I love about what I do on a daily basis. I'm here to support, I'm here to help those members and to make sure that they have good, healthy lives, which is why I'm excited to be here today and doing this work.
Again, with level setting, there's sometimes confusion between two insurance level coverages, Medicare and Medicaid. So what is Medicaid and how is it funded?
Medicaid is a state-run plan, and members have to qualify. If you are under a certain income level, you can qualify for Medicaid benefits, healthcare benefits, as well as other benefits. Medicaid is just not medical benefits. We, as Blue Cross, cover the medical part of Medicaid, and it's for members 65 and under who qualify. There's children's programs. There are programs for adults all the way up to 65. After 65, typically you qualify for Medicare, which is a federal program. So that's funded by the federal government that you're eligible for. And then based on your income, when you're over 65, you can qualify for Medicare and Medicaid, and you'd be considered what the program is considered as a duals program. So you have both insurances available to you.
So Blue Cross Blue Shield has coverage for Medicaid patients.
Correct. So we are a multi-line organization, meaning we have commercial. So commercial is when employers have coverage. We have Medicaid available, and we also have Medicare. And we have the duals. So we have members who have Medicare and Medicaid. So as I said earlier, Blue Cross is very committed to ensuring the health and welfare of the members and the communities that we serve. And so we feel it's very important to be able to have health coverage and insurance, no matter where you are in life, in your healthcare journey.
Now back to redetermination. Why is it necessary to redetermine Medicaid eligibility?
Just as you said, there is eligibility requirements. And so there are certain requirements and criteria that you must meet in order to be eligible for this type of insurance. One of them is your income level. Folks who are under a certain income level will qualify for Medicaid. You also must not have coverage available through other options, such as an employer covered or Medicare. You could have Medicare and qualify for Medicaid, but Medicare will be your primary insurance. So there are eligibility requirements. There's various ways to determine if you are eligible. A lot of folks will go through the Illinois.gov website, where there's also a variety of insurance options available to them through other programs. And a lot of times they'll learn through that program based on their income. They're not eligible for any other coverage. They'll realize they can apply for Medicaid at that time. Your provider can help you determine if you're eligible. Community agencies. So there's a lot of ways. I think there are a lot of people who don't realize they are eligible for Medicaid and have those benefits available. So we try to educate folks on that as much as possible, because we do not want anyone to go without healthcare coverage. It's important that folks are taking their medications. It's important that people are actually getting their wellness checks and making sure they're staying healthy. So we want everyone to make sure that whether it's any other insurance that they're available to them, or to be able to know that they're eligible for Medicaid.
What options are there for someone who may have missed their redetermination letter, maybe due to housing insecurity or disability or something like that?
That is a big concern for everyone. If someone actually misses their redetermination date and does lose coverage, they do have a 90-day grace period where they can go back and complete the redetermination process, right? So if they complete that redetermination process within 90 days, then they'll remain, and they're still eligible, they'll remain within Medicaid. If it's past the 90 days, they'll have to reapply as a new member and go through the entire process. So that's why it's so important that you really try and do it within the 30 days or the 90-day grace period, because otherwise you still will be able to apply for Medicaid, but you have to start the process all over again, and it can be a longer process.
About how long?
It's hard to tell. The state of Illinois processes those applications. However, they have been in the last, few years, they've added staff. They've really tried to process those applications quicker. It is an extremely large task, I must say, for every single state in the United States right now who is handling the redeterminations. I mean, it's a lot of work to go through every single member. In Illinois, before they started the redetermination process, they had over 3 million members on Medicaid. So to have to go through 3 million members and have everybody complete the process, complete their paperwork, and then the state verify, You're right. It's taking a little bit longer, correct? The wait times are a little bit higher just because of the sheer volume. But everyone is doing everything they absolutely can to make sure that members have access and don't lose coverage. But I don't know the exact length it would take if someone started again. But that's why we're really trying to get people to complete it before that has to happen.
That's so important, and I appreciate the efforts that are being taken to let people know up front that it's coming, to be looking for it, and that there are different options in which they can redetermine if they don't have access to online and that sort of thing. So that's great. So the federal government estimates that about 15 million people will lose their Medicaid coverage this year, and nearly half of them will be Black or Hispanic. Why does this change in eligibility impact these groups at such a high rate?
I would say for some of the reasons that we've recently talked about, a lot of the members within the larger impacted areas, especially with COVID, have not been able to either find access to jobs, right? So they're in need of Medicaid. They might have actually not have the technology. They might have moved, so they're not at the address they were before. So in those areas that were heavily impacted, which is basically the more of the Black and brown communities that unfortunately suffered more during COVID, I think the social determinants of health and the fact that a lot of them might have lost housing during that time, no longer are at the current address, it's impacted them greater, so it's harder for us to find them now to make sure that they can remain eligible for that. That's why it's even more important for us to focus on those areas and to make sure that we are in the community. At Blue Cross, not only do we call them up front or text them, whichever they prefer, we send them reminder notices. If by chance a member did lose their coverage, we are actually sending caseworkers out into the communities to see if we can locate these members to help find them, to make sure that we help them through that process, because again, we do not want anyone to lose coverage. So we are absolutely concentrating on those areas where we see the highest percentage of members that we feel like could be at risk.
And in what ways can Medicaid recipients be proactive in starting their redetermination process?
We love proactive folks because that also helps the entire process. So proactively, you can contact your managed care company to find out exactly when your eligibility is up. You can ask your doctor. You can ask your primary care physician. They will know as well. A pharmacist actually has your redetermination date as well. We're asking the pharmacies when members are picking up their medication, if you see their redetermination date is within the next 60 days, please remind that member while they're there. Don't forget, fill out your paperwork so that you can come back and get your medication refilled without any lapse in coverage. So we are trying to hit every point where a member could have access with a healthcare provider, with a managed care company, with community agencies to be able to give this information out. Again, primary care physicians, the FQHC providers, the clinics in Chicago, they all have the redetermination information for their membership. They're also holding redetermination dates at their clinics. And so you can go in, have access to computers. So if you want to go online and someone will be there to help you, have access to scanners. So if you want to scan and upload your documentation you need, we will help mail the forms for you, whatever is necessary to get that information into the state.
We've talked about who they can reach out to if they need help with the process. What can people like you and me do to support our communities to achieve health equity?
I think one of the biggest things that is a barrier to folks wanting to stay healthy is trust. And so trust in your healthcare provider, trust in your managed care company, your insurance company. I know that's not always the easiest thing to do, but we are absolutely here to help you. And we are here to ensure that you receive the services that you need to stay healthy. So we have care coordinators. We have folks available who can either by phone or actually we send folks out to people's houses. If you need assistance with housing, if you need assistance with food insecurities, if you need assistance with making appointments, ensuring that you're getting into the doctors, if you need assistance with transportation, we will remove those barriers and help you get the healthcare services you need. So I know it's not always easy, but to trust folks and to make sure that you are reaching out when you do need those services, or responding to us when we reach out to you, because we're going to be calling to see, do you need some assistance? Can we help you get to your doctor's appointment? Can we help you schedule appointments? Do you need a ride to the drugstore to pick up your medication? We want everyone to have access and to remain healthy. And we know there are a lot of barriers out there that make it difficult for folks to be able to. If you're faced with homelessness, your first thought isn't, did I pick up my medication today? Right? You've got other things on your mind. And so we want to be able to help connect folks to resources to get them what they need so that they can remain healthy.
I see that you guys have these beautiful Blue Door community centers in Morgan Park and Pullman and Lawndale. Can I refer someone who is not a Blue Cross Blue Shield member to go there and get help?
Absolutely. You do not need to be a Blue Cross Blue Shield member to use any of the services at our Blue Door Center. We are there in the community to help any member in the community. We find it's vitally important for communities to have resources, to have education, to have assistance where they need it, to even have a place to come and do Zumba. We do Zumba in our Blue Door Centers. We love it, right? And folks come in and you don't have to be a Blue Cross member. We welcome everybody. We want the communities to remain healthy. We want everyone to have access. It's just not for Blue Cross members.
What's one thing that you want consumers to be aware of?
That there is access, like I said, I know I keep saying this over and over again, but it is so important. There is access to good health care. There are ways to remain healthy, no matter what your age, your disability, where you live. There are resources available. If you're unsure of those resources, we can help you find those resources, but no one should not have access, and we're committed to making sure that everyone has good quality health care and is able to find that. So I think the biggest thing is just reach out, right? Or when folks contact you, be open to telling us what areas you need assistance with, because the resources are there, they are available, and we'll make sure they get them.
Well, thank you, Nancy, for this awesome and informative conversation. And thank you to the audience for joining us. Please go and subscribe to the Journey Continues podcast so that you'll be notified of all upcoming episodes. Thank you.
Redetermination of your Medicaid benefits is important and required. If you need help from Blue Cross Blue Shield of Illinois, go to bcbsil.com or visit one of their Blue Door community centers in a neighborhood near you. I'm Monica Fox, and this is The Journey Continues. Prevention's a key part of our mission at the Kidney Foundation. That's why at the end of each episode, Dr. Melissa Prest offers a health tip.
Here's today's nutrition tip about weight management. People live in bodies of all shapes and sizes. While body mass index, a measurement of your weight to your height, and ideal body weight ranges may or may not be appropriate for you. They are used as a guide to know if you're at risk for developing a chronic health condition. Many people may think weight management is about being on an overly restrictive diet that includes intensive exercising. This actually sets people up for failure and is a large reason why diets don't lead to maintained success. What weight management is about is learning how to make healthy food choices at home and when dining out. It's about learning how to identify when you're hungry or if you're eating for emotional reasons. It's about finding physical activity that allows you to move through a range of motion, strengthens your muscles, and gets your heart pumping. And it's about making choices that will help you maintain your weight or allow you to gradually reduce your weight. It may seem easy to go it alone, but research shows that those who find support and professional guidance are most successful. Here are some tips from people who have had success with weight maintenance. Exercise is important and build up to 200 to 300 minutes per week. This is the equivalent of 30 to 40 minutes a day of activity. Stay hydrated, drink lots of water, and limit sugar-sweetened beverages. Eat whole, nutritious foods and focus on foods that are high in fiber. Eat responsibly and mindfully. Pay attention to when you're hungry and when you're full. Plan your meals ahead of time. This allows you to stay on track and make healthful choices. Find fun recipes online or in cookbooks to expand your meal variety. Decrease your screen time and do not eat while distracted. Monitor yourself by keeping a food log, measurements, or weighing in once a week. Join a weight management program for education and support. Build your own support group with family and friends. Keep a positive attitude and believe in yourself and your abilities. Think for the long term. The habits you are creating should be long-sustaining and not a quick fix. And make those changes gradual so that you can stick with them over time. With today's nutrition tip, I'm Melissa Prest, a registered dietitian nutritionist and the foundation dietitian for the National Kidney Foundation of Illinois.